Okay, so hello everyone, and thank you for coming to our webinar, the IR-bound intern webinar, brought to you by the Society of Interventional Radiologists, Medical Student Council, Education and Research Committee. My name is Hector. I am a student, third-year student at Ponce Health Science University School of Medicine in Ponce, Puerto Rico.
And my name is Kathleen. My name is Kathleen. You guys can call me Katie. Either way is fine. I'm also a third-year student at Ponce Health Sciences University, and I'll be helping out tonight.
Yeah, we are your coordinators for this webinar. So, as many of you know, we are almost upon application season, and we're very lucky tonight to have 5 parent residents that took out their time to speak to us about their intern years and speak to us about how to navigate and figure out the confusion of choosing an intern year and what it's like. We have a few different options, including medicine and surgery preliminary years or a transitional year. And tonight we have both surgery and medical interns, but unfortunately we don't have any transitional years. You are really welcome to check out an article by a transitional year intern published on the MSC website. So this will be our agenda for tonight. We are going to introduce our resident panel. We will have a brief summary of their intern year experience, and then we will do frequently asked questions, including questions regarding overall internship experience, questions regarding maximizing the experience for IR residency, and questions regarding applying for internship here. After, we will have questions submitted by the audience for our panel. Okay.
So, just like Hector said, we're going to have a lot of questions discussed. But for people who are interested in asking questions on their own, or questions that come up that we don't answer, we ask that you direct those questions to Hector, and you can do that by selecting his name, HB, from the chat box drop-down menu, and then he will announce your questions or comments to the panelists. So those questions can be answered during the Q&A session at the end. So we kind of ask that you guys, hold your questions until that time. And then he will go ahead and ask your questions to the panelists. And all of the questions and all of the comments will remain anonymous. And I think that's it. Is there anything else you want to add, Hector, before we get started?
Sorry, yeah. So we're going to ask you to please refrain from asking questions at the beginning, and thank you. So, Katie, why don't you go ahead and get started on introduction?
Yeah. Is Dr. Alexander here? I can't tell because I'm calling from my phone, but hey, no worries, Dr. Alexander. Yeah, wonderful to have you here. We're super excited. You think you could go ahead and just give yourself a little bit of an introduction?
Sure, and please call me Erica. I'm a second-year resident, or PGY2 R1 over at the University of Pennsylvania, so the R2 is a little bit wrong. I'm 1 year out of surgery intern year, which I also did at the University of Pennsylvania. And I only applied for surgery intern years. I feel positively about my experience, although it was a hard year, and I'm happy to talk about that a little bit more during the course of this webinar and also offline. Anyone's welcome to email me. My email address is erica.erica.s.sam.alexander@gmail.com. So if you guys have any questions during the webinar or afterwards, I'm always available. I was an undergrad and medical student at Brown, decided that I wanted to be EPEN because of the strength of the IR program, the diagnostic program there, and decided to do my intern program at the same institution because I wanted to know the EMR, know the system, and also figured that the friends that I made during my surgery intern year would also be around, which did definitely hold true. So that's kind of my story, and I'm sure I'll be asked other questions during the course of the webinar as well that I can answer.
Wonderful. Thank you so much. I think the next person we have is Dr. T. Is Dr. T around? Hector? You know if
Hi. So no, he's not. Let's just keep going.
he's not. He's okay. Is Jeff online? Dr. Dalton?
Hey guys, you can see that picture from Happier Times. So I'm currently doing a medicine year, and it's pretty great. I think that the biggest thing I would say that you learn as an intern is how the hospital works. You get to work very closely with physicians from a lot of different disciplines. You get a sense of the questions that they're trying to ask, the decision points that they are reaching, and basically what they need to know in order to go through the treatment. And I think that as we think about IRs being able to step into the role as full consultant rather than being a proceduralist, it's really good to have that kind of experience. And so I think the harder you can work and the more experiences that you have, the better. So I think it's been positive. It's been challenging, but I think, you know, right now I'm on cardiology and I'm seeing a lot of different patients who are coming in, and I've got pulmonology. I've spent a month on nights, a month in cardiovascular ICU, a month in medical ICU, and yeah, it's been pretty great. So I think that you're going to get really good experience. I just think that when they put you in the game is going to be when you learn the most.
Wonderful. Thanks, Dr. Dalton. We'll go ahead and move on now to Dr. Martinelli.
Hey everyone, this is Brett Marinelli. So I'm actually in the middle of my PGY1 year, my intern year at UPenn. So I'm following in Erica's footsteps, and it's been a good experience so far. I can definitely talk in more detail about what I feel the pros and cons are. So I went to medical school at Mount Sinai in New York. I'll be going there for radiology next year. So I'm actually not sticking around at UPenn, and my choice to go to UPenn was actually predominantly personal. My girlfriend's here, and I really wanted to be in the same area. And so I applied to some programs in the area, and I think UPenn was the best one, and I was fortunate to get in. Being a prelim, I think, is definitely a different experience than being at the institution long term, but I think it was a really good choice to make for personal reasons. And I think that overall, the one piece of advice I'd give everybody is, you know, understand there's no right answers here. I think it's actually an opportunity pursue something that you're interested in or to fulfill personal obligations, be in an area that you want to be for a year. So that's one thing I'd say. I'd also like to extend an invitation to everybody to reach out and ask me questions offline. My email is brett.marinelli@gmail.com. You can shoot me an email whenever you'd like. And that's it.
Thank you so much. That's super generous. We'll be sure to include that to people and send it out after this. Our last panelist is Dr. I'm going to mess this up, but Dr. Warha Pandey. Is that correct?
No, Shantanu did not make it. I'm sorry. Our next panelist is we have Dr. Nikki Keith. Could you introduce yourself, Nikki?
Hey guys, I'm Nikki Keith. I am a PGY3 at the University of Virginia in the IR pathway. I did my medical school at SUNY Upstate. I'm from Buffalo, New York originally. And I did my intern year at UVA in general surgery. Much like everybody else has said, it's kind of a personal decision. I love my intern year, although my husband says I have Stockholm syndrome. But I do think that it was a great learning opportunity. It's kind of a steep learning curve when you start year, as it is when you start radiology for every single rotation you get to. Surgery was my personal preference. I only applied for surgery, not just because that's my personality and that's what I kind of fit into, but also I think it had a lot of benefits when I got to radiology to understand a lot of the surgical variants and changes that you make in the operating room and what to expect in a post-operative patient. That really helped me understand a lot of radiology stuff. So again, like other people said, you're welcome to email me afterwards, or if you're interested in a surgery year or UVA in general, I'm happy to help answer any questions that you have.
Thank you. Thank you so much.
Thank you. Let's move on to our pre-planned questions for our panelists. So first of all, we're going to start with these questions about everyone's intern year. And the first question is, why did you choose or rank the type of intern year that you did? We will start with Dr. Alexander.
Yeah, and I'll just jump in real quick here and say we're going to go through the same kind of rotating order that we did for the introductions. So we'll just go through you guys just like we did just now in that same rotation.
Okay, so this is Erica again. So the way that I ended up ranking my intern years, and you guys will become intimately familiar with this when you're going through the whole year-off process, but for every categorical radiology or now IR direct program that you apply to, you also have to provide a corresponding rank list for that particular program for an intern year. UPenn was my first choice for radiology residency. So I subsequently made UPenn surgery prelim my first choice as well. And then I kind of based it regionally because there were certain cities that I wanted to live in, and there were certain areas that I thought would be more convenient. But the way that I went through each of my ranking order for categorical radiology programs was that I would generally apply to the surgery prelim related to that institution and then kind of just rank everything subsequently from there based on preference. So it becomes a little bit relevant when you're applying for your radiology residency. So I actually applied to the corresponding surgery prelim year at every program that allowed me to. I noticed that some institutions don't actually have surgery prelim spots, in which case I just tried to look at other regional programs in the area. And as I said earlier, I wanted to be at the same institution for both my intern year and for radiology residency for a number of reasons. I didn't want to move more than once. I wanted to have a community and a sense of familiarity with the city. I wanted to make friends that I would keep going forward. So that's kind of the first component of that answer. And then the things that I liked the most about my year were largely the people. So I had heard a lot of concerns about coming to a place like Penn, and I think that they were largely untrue. You're going to find in every program, even now that I'm in radiology, that there are some harsher personalities or people that you may not necessarily have quite as much in common with. But the surgery people at Penn were actually incredibly likable, incredibly good people to work with by and large. I really enjoyed that my friends in Philadelphia, or some of my closest friends, are still the urology and ENT residents and some of the surgery residents that I spent a lot of time with. And it's nice that I get to still get together with them, and am invited to one of their weddings this coming summer. So you really do build really, really deep relationships with the people that you go through that year with. I also think that it prepared me very, very well for interventional radiology and diagnostic radiology as well. So the nice thing now that I'm in DR is that a lot of the people who call down to the reading room are people that I've worked with. So there's definitely a rapport. There's a sense of like mutual respect, and it's nice to know the people that are your referring providers. And then when I was on interventional radiology, I found it very helpful to have done a surgery intern year because I was able to really manage patients well in the perioperative period, which is where you're also going to see complications in your IR patients as well. And one of the nice things about surgery at Penn, and this is one of the, I think, rumors that I heard, is that you don't really get to operate at big programs. But as a prelim resident at Penn, you actually rotate through a lot of the smaller ancillary hospitals, and you do have the opportunity to operate quite a lot if you choose to. But you also can do a fair amount of floor work, so you can kind of gauge where you are based on your interests and express them as such. But you do learn to manage patients really, really well at a place like Penn, and you learn to manage very complicated patients as well. The things that I like least about the year were probably the schedule. So you're going to hear this from a variety of people that do surgery intern years, and I've heard this from almost everyone I know. The 80-hour maximum work week is kind of an illusion. You stay as long as it takes to get the work done. So it's long, they're hard. There are many, many times where I worked, close to like 21 days or so without having a day off, and you do get a little tired of being tired all the time. But once you get to radiology, you're going to see that life is dramatically improved in terms of scheduling. I would not have chosen a different intern year. For all of the reasons that I said above, as Nikki said earlier, it might be a small component of Stockholm syndrome, but I was happy with my experience. I think I'm a better radiologist for the experience that I had, and I definitely think I'll be a better IR for being able to manage patients in an acute setting.
Wonderful, thank you. That's super, super helpful. Let's go ahead and pass on to Jeff, to Dr. I'm sorry, I can't remember. Is Dr. Chi here with us tonight?
He is not, no.
Okay, so let's go ahead and move on to Dr. Donaldson then.
Sure, and you guys can call me Jeff. So yeah, I'll echo what Erica said. I think that you definitely get a sense of, some of the things that I've learned very well is the uphill battle that IR will be facing in establishing a culture of IR as a clinical specialty in hospitals where it's not, and so I think that it's very educational in that regard. I think I've had a lot of freedom to get to know and get in depth with a lot of different specialties and focus on a lot of very ground level issues. And I think that each person, when they come into radiology, is going to think a bit different and look a bit different, but the experiences that you have in the intern year are really going to help shape your perspective going into it. And I think that my year has helped me to have a very broad appreciation of the challenges that doctors in medicine face, the challenges of delivering hospital-based care. And I think that the more that we can be aware of those things as IRs, the more we're going to be able to find opportunities to help and to improve people's care. And I think that as you think about the questions that people are asking when somebody comes in, somebody who's very sick with from a number of different systems, they don't necessarily have a well-defined picture of what's going on with the patient, and that's very, very many of the admissions that we get, especially in ICU. And you're just trying to pick the system that is the most crucial to support, and there's any number of things that are going on at the time. So having a having a number of experiences with that will help to form your perspective, and then once you get into the position of working as an IR, will help you to add value to those kind of situations. You know, for example, if you notice that the patient's pleural fluid has amylase in it, maybe you could ask, hey, does this guy have a pancreatico-pleural fistula, which this fellow did. And he saw probably 7 different doctors in multiple outpatient settings before I think it was a pulmonary doctor who finally got someone on the phone through the chest radiology to be able to figure out that this guy did have a passageway between those two spaces, and that was what was causing all the symptoms. But you can really save the day by just being able to put together pieces of information that have been siloed or isolated between two different fields. And so much of medicine is broken up and isolated between the different fields. So, but the real benefit of doing an intern year is that you're able to travel back and forth and work with those different specialists and get a sense of all of their different information sources, so that when the time comes, you can just have that little bit of information that can help connect those things. So I don't think I would have chosen a different intern year. I had a lot of family considerations for why I chose the program that I did. I wanted to have a very stable place. I'm going to Cleveland Clinic for my radiology program, and so a nice spot where I have 2 little kids, and so where they could settle and be in a good place, and so that was very central for my decision making. But I think it's been a challenging year, but I think I've learned a lot, and so I think that going forward, I think that any experience that you have is going to be good. I think I just encourage you to try to find places where they're really going to give you lots of opportunities to do different stuff.
Wonderful, thanks, Jeff. That was really great, really helpful. We're going to move along now to Dr. Martinelli.
Hey, yeah, and you can call me Brett as well. I feel like we're not quite senior enough to even really deserve being called doctor by our last names. First of all, I'd like to actually thank you guys. I forgot to on the introduction for doing this. I wish this existed for me last year or 2 years ago. I was completely clueless on kind of how to go about intern year. I knew I wanted to do IR, and everybody seemed to push surgery year, attendings that were getting the new integrated program situated, and I don't think they really understood maybe what a surgery intern year is like now, or maybe they, it was just 1 year for them whenever they did it. So that kind of got me started along, although while the year has been great, I question how absolutely necessary or valuable it may be in the end. I definitely agree with what Erica was saying about understanding perioperative care, taking a look at all the scans in the postoperative setting, so many things that I'm learning radiology-wise before even starting my radiology residency I'm doing now. So there's definitely use there, but, we're going to be IR physicians many years from now, and to be perfectly honest, I'm not sure how much I'm going to remember. You know, I will say I think I've learned a work ethic. I've learned how to hustle in a way that I've never done before, how to be efficient. But on the other hand, I've definitely lost an ability to create differential diagnoses like I did in medical school, you know, coming off the step exams. I've definitely really become more of a grunt than somebody who can think more intellectually about medicine. So I would say that's the downside. However, you're probably going to get that in any intern year, no matter what you do. You know, for me, getting back to the reasons why I chose surgery and surgery at UPenn, it was really, truly personal, trying to be in the Philadelphia area, to be with my significant other, and you know, just trying to be in the best program I could get into. And also along those lines, there's a lot of programs I applied to that I found out later on down the line were taking maybe 1 prelim or 0 prelims. And that caught me off guard. So I would definitely encourage people to do research on programs, at least like no later than July or June, the fall before applying. It may save yourself a lot of hand wringing trying to figure out whether you're going to get an invite for an interview or not, because some of them just may not be taking many prelim interviews. I guess I'll pause there and let the next panelist add something.
Okay, great. Thank you so much, Brett. We're going to move on then to Dr. Keith, if I'm saying that correctly. Is that Nikki? Are you there?
Hey, can you guys hear me? Please call me not Dr. Keefe. We're not that formal. As for again, I only applied to general surgery, but that's just my personal preference. Everybody kind of has their own opinion. If you like to round and if you like to talk about how to manage chronic disease and that's your cup of tea, then you should do a medicine one. I loved surgery. I loved being in the operating room. As an intern at UVA, I was in over 100 cases as a first assist. I didn't count any of those ones where I was retracting. That's just crap. And so I got a lot of opportunities to do a lot of cases. I encourage you to try and find a program that allows you and affords you the opportunity to do that. It's very challenging to figure out what those programs are. And even when you interview, it's still challenging because they're going to want to put their best foot forward. But you kind of got to weed out the programs that are going to treat you differently as a prelim than as a categorical resident, whether it's medicine or surgery. You want to be in a program that treats you equally and affords you the opportunity to learn as much as their categorical residents. I got that at UVA. As you've heard, people got that at different programs, but you just got to figure out what program is right for you. I found that doing general surgery was very beneficial both for IR and radiology. Ultimately, we all have to pass the radiology boards too, so we want to make sure that we're well trained in radiology. Seeing in the operating room how things change and the concerns that you look for post-operative, like a bio leak for a lap chole or something, one of those routine procedures, or for gastric sleeves or something. Understanding the operative anatomy really helped me move forward in radiology faster than some of the people who maybe did a PY year or an intern year in medicine. The other thing is I would really advocate to try and do your intern year at the same place. I know there's a lot of family issues. You may want to stay in the same region or you're staying behind for family, whatever. But if you can, I would advocate to do it at the same place because not only do you meet all of the attendings and residents that will be with you for the next 6 years in the IR pathway, but you're also learning their EMR. You're getting familiar with the system. That way when you get to radiology, it expedites everything and it just makes your life so much easier. You know who to call. You know what name to look for in the notes when you're looking for neuro or trauma surgery or whatever. And it's just a much more familiar environment to you that I think it really helped me as an intern. if I had to do it again, I would choose the same exact thing. I felt super supported at UVA that if I ever needed anything as an intern, you know, they were always there to help me, whether it was like a personal thing or a patient thing. I could just call any one of my chiefs and they were there, which I think is unique among surgery programs. They always have this stigmata that it's, you know, cutthroat, but that was not the case here, and I was very happy here. I guess that's it. I'll wait for the next question.
Okay, great. Thank you, Nikki. And I think we've gotten some really, really great answers here that have largely answered the questions posed in the first 2 slides of the PowerPoint here, or the question slides rather, which are questions regarding your intern year and maximizing your intern year. You guys have both, or all of you have touched on, you know, how internal medicine served you or how surgery served you, you know, in different ways, and why you guys chose the programs that you chose. So I think it's appropriate now to move on to the slide that asks about questions regarding applying for intern year. So these questions are specifically, what should applicants look for in programs when they're applying and when they're interviewing? What do preliminary programs look for in applicants? And how could a medical student prepare for an intern year as an MS3 or MS4? And we're going to, again, follow that original order that we started with the panelists. So we'll go ahead and turn to Alexander first for those questions. And if you guys need me to repeat them at any point, I'm happy to.
Okay, so I think that what you should look for in a program is really personal. You're ultimately spending a year in this program. If you end up at the same institution, there's obviously a lot of benefits, like I talked about, like the relationships that you form with your co-residents during your surgery intern year. But I think that this is really an opportunity where if you wanted to, you could live in a different place. We all know someone who's actually really involved in the SIR-RFS who did her intern year at the University of Hawaii, because where else, you know, what other points in your life do you get to spend an entire year in Hawaii? So she had that experience. Other people will, you know, live in interesting places for the year, or they'll live in a place where they can be near family or significant others. So I think this is really some time to do some self-reflecting as to what you want out of that experience. In terms of like the culture, there are some places where you'll interview, and the same is true for radiology, where you'll just get like bad vibes from the program. You'll find out that these people don't mesh with you, that you don't have a lot of common interests, that these are not the kind of people that you want to be spending 100 hours a week with on occasion. So that's really what you should look for, especially if you're going to apply into something like surgery. You're going to spend a lot of time with these people. They're going to be your main source of friendship and emotional support. They're going to be the people that you spend all of your waking hours with at work, and probably most of your waking hours with outside of it, because you're not going to have a lot of time to meet other people. So you should be in a place where you're going to enjoy the people that you're around. Things to look for are these places that are attracting a lot of people who already have families and are married, or is this a place that's going to attract people that are younger and at a more similar life space as you? So once again, highly personal, and these are just kind of basic judgment calls, like where are you going to fit in, what region of the country do you want to live in, et cetera. For the second part of the question, when I was at a certain New York surgery program, one of the people interviewing me put it best. A prelim surgery program is looking for a warm body and making sure that you're not crazy. So really what they want to do is they're finding people who are able to do the work that they want. And this is probably actually true for any prelim program. If you're competitive enough to get into a diagnostic radiology spot or a direct SIR-IR spot, you are definitely going to get into a surgery prelim spot somewhere, because there are usually more surgery prelim spots than there are applicants. You should take the interview seriously, like obviously wear a suit and do your best. But what I actually found during the application process is that whenever I got a radiology interview at a particular program, I would separately contact their surgery department where I had applied and ask them if I could coordinate my surgery prelim date at the same time, so I didn't have to make a separate trip. And most people were happy to accommodate that. Additionally, the surgery prelim interviews tend to be a lot shorter. So a lot of times, whereas you'll be at the radiology program for almost an entire day, some of my surgery prelim interviews only lasted about an hour or so. And they're really just taking a peripheral glance at your resume. They're making sure that you're going to be competent and capable and that you're matching the person that's on that ERF application. So at least for surgery, it's a fairly low bar actually for what they're looking for. But still take it seriously because you need to match into a surgery prelim year, and you should also try to do your best wherever you end up. And then the best way to prepare for your intern year, you're going to hear different things from different people, but especially your MS4 year is really like the last opportunity that you have to really enjoy yourself and be a well-rounded doctor who's going to have exposure to different subspecialties. So I don't think you should do everything related to whatever intern you're going to go into. Like, don't do a million medicine sub-Is, don't do a million surgery sub-Is. You should do a couple of surgery sub-Is if you're going to go into surgery, just so you understand what it's like to round on patients and how to organize your time a little bit better and be familiar with the OR in terms of different equipment and how to do some basic floor procedures like drain abscesses and do INDs for patients in the ED, and that's kind of what you get out of the sub-I experience. And, be really good with your suturing skills because those are things that you should be proficient with. But if you want to have a basic idea of how to evaluate rashes, feel free to do a derm rotation and feel free to do an anesthesia rotation so you're comfortable intubating patients in the case of an emergency. So I would really broaden your experience. Also, everyone should try to have a great trip during their MS4 year. Even if it means taking out some more loans or, asking your parents or spending more money than you probably should, because it's the last time you're going to have a really big chunk of time to go do something great. So I'm a big believer that you should travel and take a little bit of time off, because a lot of intern years trial by fire, and you're going to learn what you need to learn because you have to. So I wouldn't fret so much about trying to make your MS3 or MS4 year some sort of mini simulation session for that experience.
Wonderful. That's really great holistic advice all around, Alexandra. I think anyone can benefit from that advice. We'll go ahead and move on to Justin.
So I think that I interviewed at some great surgery programs as well as medicine programs. I think that one thing that I did not know going into it is that a lot of surgery programs that you can apply to do not necessarily interview. There's a number of programs that get everyone from the scramble or they try to get everyone they can to fill the surgery spots, and then they fill from the scramble for prelims for the rest of them. So it can be good to build in some flexibility in terms of where you interview, and also if you do have flexibility in terms of where you can live, that's kind of ideal. For example, I had originally planned to do a surgery year at SUNY Upstate, where I went to med school, but it turned out that they didn't interview the surgery prelims. They just got them from the scramble. I kind of didn't feel comfortable with the level of uncertainty that provided, and also felt like it would be nice if they, wanted to meet me before sending me on for the year. But for me, I had the choice of either doing intern year in Syracuse or doing it where I was going to be for residency. So I didn't have as much flexibility, just having the young kids and everything. But do be aware of that in terms of factors in when other people are going to be applying. And for example, they there's just different levels of I guess you'd call it literacy about other specialties among program directors. I heard one surgery director say, it's well, why would you be doing a prelim year anyway? And I thought that, and I think he's maybe doesn't realize that that some programs only have prelims. Like, you know, I mean, like anesthesia and neurology, they're combining them, but some of the programs only have prelims. But he seemed to be under the impression that that was the case for everything. So you have a real heterogeneous population of people who are going to be looking through your applications. So I think that it's good to keep that in mind. If you can apply to places where you know other people have gone, that's really ideal. For example, I interviewed at St. Joseph's in Colorado, which was the surgery year that Andrew Chi did, and that would seem like a great program. And if I had gone to Denver, I would have gone there. It's just stuff like that. Try to use word of mouth as much as you can. And just think through, like, if you're comfortable doing the scramble, I understand there's some great spots to be had from there. I couldn't do that, but a lot of programs feel like they get really great candidates, and it's a good way to get what they need to done. So I think that's a good thing to be aware of. And it creates a really complex picture when you're trying to line up your intern year and your radiology year. But I think it's just to try to do what you like, go where you feel comfortable, and do what makes the most sense to you. I think is the best way to approach it.
Okay. That makes a lot of sense. We'll go ahead and move on now to Brett.
I think I'm up next. Yep. So building off of what Jeff said, I'd like to share my story of applying to surgery prelims. So I applied to about 14 in the New York, New Jersey, Philadelphia area. Was really hoping to get Philadelphia because that's where my significant other was. I ended up getting 2 invites to interview. I didn't know that pretty much all the other programs, sure enough, got most of their prelims from the scramble. And the others, I just maybe wasn't fortunate enough to get the tap. That created quite a big deal of stress. I had no idea how many of these programs just do not really take the time to pick their prelims. They truly are a warm body. So that would just be a warning to everyone. Also, there really wasn't that much information that I could get easily about a lot of the programs. You know, maybe it was my fault. Maybe I didn't have a big enough network. And actually talking to some underclassmen that have been applying to IR integrated or radiology for the past couple of years, they've shared that they've struggled as well. So maybe one suggestion to the community could be to start a database or a blog just describing their experiences at different prelims. I know if I ever found something like that that was reliable, that I trusted, that would have been incredibly helpful. So anyway, I had 2 interviews, and I was fortunate they were both in Philadelphia. I showed up to my UPenn interview. There was nobody available to take me for a tour. We talked in a conference room with the rest of the applicants for about 5 minutes. I went to meet with one of the attendings for my interview. That lasted about 10 minutes, and that was it. Then I grabbed the bus home. So overall, my interview was about 30 minutes. I've had a terrific experience this year. I think that despite rumors that the program was malignant and everything, it actually ended up being fantastic. Everything that Erica's mentioned about the program is 100% true. It's been an invaluable experience. But I feel like the interview process was hard to interpret, and I would just give that warning to folks and really utilize the IR, SIR Connect, and the network, because we've all been through it. We want to help you guys out, and I think that's another reason why this panel is terrific.
Awesome. Thank you so much, Brett. I think Nikki is the last one we're going to ask to weigh in on these questions.
Just to comment on what you said, Brett, the list of intern years is something we had thought about in the past through the Med Student Council, and it's not possible without questionably putting down certain intern years and promoting others. So that list does not exist yet, but by going to panels like this and contacting people that you know or contacting any of the panelists, that's the best way that you can find out about different intern programs. As for what to look in a program, again, it's super complicated. I personally only applied to a few programs, maybe like 3, and I did 2 Skype interviews and 1 in person. I was like, it's intern year, it's going to suck no matter what. I'm going to learn a lot, but if I have to scramble, then I scramble. The important thing to me was where I matched for residency. It worked out. I came to UVA, but it's 4th year interviewing is so expensive, and the surgical intern interview is so fast. And like everybody said, the majority of them, they pick in the soap, and the interviews are so short, it just wasn't worth it to me. So if that's the method that you want to go through, it worked for me. So I think it's reasonable. What do they look for in applicants? Someone that can do the work. You just want to show that you're diligent, and that's what you've done through all of medical school. So there's nothing that you can put on a resume or anything to show them in particular than anything that you've already done to get into radiology, that you're going to be a good applicant. And what to do to prepare for intern year, you should do nothing. You should enjoy your 4th year of medical school. It's the last time of your life for a long period of time that you're going to have a significant period of time to enjoy things. Go and travel, go and do some hobby that you want to do, go and spend time with your significant other, because God knows that you're not going to have that much time intern year. But go and just enjoy life and don't worry about intern year. Like I've already said, it's a completely uphill learning curve that first week or 2 where you have no idea what you're doing and you just learn it all on the fly. There's nothing really that you can do to prepare for intern year. It's just going to hit you in the face, and you're going to do fantastic because you've matched into the IR pathway, and only fantastic people match into the IR pathway, so you're all going to do awesome. So yeah, okay.
Wonderful, Nikki. Super, super positive, super encouraging. We haven't actually gotten any questions from people listening, like that are outside of the questions that we have proposed to you guys. So I think to wrap this up, because like we're coming in on about an hour now, I just want to give everyone the chance to add anything that you feel like you haven't been given the opportunity to speak about that you think would be useful to MS3 and MS4s. So we'll just go one last time through the rotation of people that we have, and you guys just feel free to speak freely about anything that like you wish you had known as MS3 or MS4, or anything you feel that hasn't been touched on thus far. So we'll go ahead and start with Alexandra again.
Okay, so there's a couple of things, and these are, you're probably going to hear different things from everyone on this panel, but honestly, I wouldn't worry so much about your prelim year. I think that at the end of the day, I also wouldn't worry so much about the whole matching process. I think what you're going to find out is that there's a huge competitive luck that comes with the entire process. A lot of times you'll see people who have very similar stats and very similar experiences to you that won't get interviews at certain programs, and some who will. And at the end of the day, once you're looking at a certain caliber of programs, the experience that you're having is that you're going to have is going to be really comparable across all of them. So I wouldn't go into the process with any clear idea of, or with a particular program that you have to end up with, because there are numerous programs across the country where you're going to be well trained, you're going to pass the boards, you're going to, if you have to do an ESIR pass, you're going to get into a good fellowship, and you're ultimately going to have a great career. I would say that wherever you are, whether it's an intern year in surgery or an intern year in medicine, I would do your best to always be appropriate and always do your job well. I think it's very, very easy to become disillusioned during any intern year. One of my friends kind of put it best where she's like, you just get tired of being tired all the time. And I think that under those circumstances, sometimes it's easy to be, you know, come across as like just a really like negative misanthropic person. I've probably definitely had those moments. But I think that do your best to do a good job. If you're staying at the same institution, it's a small world, it's a small hospital, people talk, and I think that having the people from your intern year be able to speak highly of you or even be able to feel neutrally towards you is really important. And you also have an obligation to your patients. So even though you're ultimately going to be a radiologist, even though this is one finite year of your life, learn a lot and do your best because you're taking care of people. And you're going to find the one thing that's kind of terrifying being an intern, even like a surgery intern. I remember my chiefs would be in the OR the entire day, and I would be managing at times some incredibly sick, complex patients, and you're the first person to get a call when something is going awry on the floor or when patients are crashing. So do your best to learn as much as you can to be proficient at your job and to be reliable, because even if you never use these skills again, and I kind of agree with that, I worry that I'm not going to retain a lot of this information going forward. But you'll be surprised, you know, there's a lot of this that becomes muscle memory because you're doing it over and over again. But take this seriously, do a good job, and have pride in the work that you're doing, even if at times you feel like you're kind of this work monkey who's being completely scudded around. I think the other thing is work really hard to try to preserve some degree of sanity. I remember that there were weeks when I worked like well into the 90s to 100 hours a week, and it becomes very, very easy to like feel like your entire life is becoming the hospital, but like try to maintain some degree of normalcy, even if it means like occasionally going out with your friends for like brunch or being sociable or running or exercising or whatever you do that's important to you. So those are kind of my pearls before I pass on the mic to someone else.
Great, those are super awesome pearls. We will go ahead and move on now to Jeff.
So
Jeff,
I'm gonna, yep. So I'm gonna borrow a phrase from religion and say that if many of you are going to end up in places where there are not the sort of assertive clinicians in IR that we've gotten to know through our experiences through SIR. And in a lot of ways, you're going to have to be that change that you wish to see. And also, you're going to have to kind of go into very open-minded about the kind of IR that you see and other people's preconceptions about it. And if you're working in a hospital setting where, let's say, people have limited experience with IRs and radiologists with clinical interest, you're going to encounter a great deal of bias, and you may even encounter bias from the people that you are interviewing with. So I would say just take it with a grain of salt. Have a few radiologist jokes in your back pocket to break the tension if they've been joking about radiologists and then they're like, oh, hey, you're a radiologist. So but you know, just try to stay lighthearted and recognize that some of it is just some of it may be a bit of sour grapes because radiologists have a bit more occupational freedom than people do in most other fields, and it also is very highly compensated, and you can also make your own hours depending on what you want to do. Those are all things that you don't really realize until you see people working in hospitals, and it's so right now what you guys who are medical students see applying and being accepted as sort of the goal and the end all and be all of your existence. But I want to encourage you and say that you all are going to get there, and you're all going to end up in very good places where you're going to learn a lot. And I would say just try to, and I'll echo some of the people on the call, enjoy the time you have, and just do the things that have gotten you as far as you are now, and everything is gonna come together. So those are my words.
Thanks, Jeff. I think that's super valuable for med students to hear. Since we're so anxious about the next phase. So we'll go ahead and move on to Brett now. Brett, are you still with us? All right. If Brett's not there, then we will just finish up with Nikki.
Hey guys. So just a few more comments. Kind of as the most senior person on this call, I guess it makes me feel really old. But a lot of the things that I've learned on intern year about how to care for acutely ill patients, kind of the different variations you see in surgical anatomy, I use on a day-to-day basis, whether it's in case conference or while I'm reading at diagnostic radiology or an IR. So learning stuff intern year, I only have the surgical perspective, but I'm sure medicine applies in this regard also, is very important. And what you learn carries with you, to kind of echo on Erica's statement of not sure if she'd use this in the future. The other kind of tidbit I would give you is that the practices that you instill in yourself intern year are things that you should carry forward with you when you are an IR resident fellow attending, and particularly to pay attention to and give respect to the techs and the nurses that you work with. They're the people that take care of the patient beforehand, during, and after the procedures that you're doing, and you never want to give them shit. You want to respect them and take care of your patients and have a very good relationship with those people. They're the ones that can make your life wonderful or miserable when you're on call, both in Gen Surg and in IR. And so to have a good relationship with them and kind of instill those values in yourself when you're an intern and carry them forward can be very beneficial in the future, not just for IR, but for diagnostics when you're on any sort of procedural service or talking to ultrasound techs that did the ultrasound that you're reading, kind of working with them in a collaborative as opposed to a I'm the doctor and you're the nurse environment can be beneficial for you and them moving forward. Again, as kind of everybody else stated, you guys have any questions for any of us, please feel free to shoot us an email. We're all more than happy to answer any of your questions. If you just, what kind of away elective should I do? What should I cater my personal statement towards? Kind of any of those questions that you have about applying or intern year or even residency in the IR pathway in general, we're more than happy to answer those for you. And I'm sure they'll send out our emails for you in the future. Okay.
Yeah, great. Thanks, Nikki. And that's right. We will provide people with the recording for this webinar as well as you guys' contact info. And I have to say, one of the things that's just so special and wonderful about IR is the community and the mutual sense of just uplifting and supporting one another. I think that's something that's kind of unique about this field compared to other specialties in medicine. And before we sign off, I just want to also say thank you, especially to Dr. Erica Alexander, whose name I messed up like a few times during this webinar. Thank you so much for your graciousness and humility with that. And thank you to all of our panelists. Your feedback was really valuable, I think, for people applying to IR and people, applying to residency in general as well. So we'll do our best to make this available to our local communities. And I think that's it for tonight. We've been on for a little over an hour now, and we so appreciate your time. We know you're super busy as interns and also as residents, and it just it means a lot that you guys took time out of your weeknight evening to chat with us. Hector, is there anything else you want to add? Are you still on? I know you're having some technical difficulties. All right.
No, I just want to say thank you to everyone who's team. I thought this was a really great I was kind of having some audio too, so sorry to everyone that but thank you all for coming.
Yeah, it's still a little bit difficult to hear you. But I think the gist of what he was saying was just real gratitude to everyone for participating tonight. So thank you again, and we'll be in touch with you guys in the future. Yeah, go ahead, Brett.
Hey, I got cut off there. If anyone would like to hear the end of that monologue, feel free to shoot me an email. And again, thanks for organizing this, guys.
Okay, awesome. Yeah, and thank you, Brett. We will we'll definitely include your you guys' contact info here for follow-up. All right, so we're going to call that an evening then. Thanks again to all the panelists and to everyone who participated. This was a really special experience. Take care, you guys.
Thanks. Have a great night.
You too.